Hi everybody, as you've just heard, my name is Eileen Kennedy and I work as the Gynae-Oncology Liaison nurse in the South Infirmary. I suppose just to start today, I'd like to acknowledge a lot of you here know me, and I know an awful lot of you, and I suppose an awful lot of people here are at different stages in their ovarian cancer, and I suppose my talk will give a general overview. It probably won't touch a lot of things that are important in a lot of your lives, and I think just because it had to be a general overview, so apologies if it feels like I haven't understood your stories. Ovarian cancer, I think, could be described as a journey along an unfamiliar road to an unknown destination. But I think today is very important because today ovarian cancer is getting a signpost and being put on the map in Ireland, a place it well deserves and needs to be. Just to give you a general outline of ovarian cancer, as you can see here, this is a lady's pelvis, and you can see deep within the pelvis the ovaries are the white little dots that look a bit like eyes, then the fallopian tubes leading to the womb and down into the vagina. When a woman is diagnosed with an ovarian cancer, as there are about 350 women a year in Ireland, it's the fourth most common women's cancer in Ireland. What happens when you get ovarian cancer? Ovarian cancer is when an abnormality happens amongst the cells within the ovary and they grow out of control, growing into a lump or what we call a tumour. Because the ovaries are deep within the pelvis, a tumour can grow unnoticed, as June was saying earlier, very often without any symptoms. These tumours can grow quite large without being detected, and it's not often apparent that there is a problem until the tumour presses on a kind of a vital organ or some nerves. And this is very often why ovarian cancer is diagnosed at a late stage. The next slide is just going to give the common most symptoms that women present with when they are diagnosed with an ovarian cancer. And when we look at these symptoms, if you look at the most common ones on the top, swelling in the stomach, abdominal bloating, fatigue or tiredness, indigestion, pain in the pelvis, the abdomen, the back, or pain during intercourse. These are all very vague symptoms that can often be associated with very, very simple illnesses, such as a tummy bug, irritable bowel. So very often it's not a GP's fault or it's not a patient's fault that ovarian cancer is diagnosed at a later stage. It's just the physicality of where it's based. The ovaries are based in the body, really. How is a diagnosis made? Once a patient has, I suppose, been to a GP and there's a suspicion or a physical examination, then there'll be scans. If there's a suspicion of an ovarian cancer, a patient is normally then referred to what we call a gynae-oncologist, which is a specialist surgeon who operates on gynae malignancies, and there's two of them here, Dr. Coulter and Dr. Yu today. Confirmation of an ovarian cancer is made under a microscope by a histopathologist, and if a diagnosis is made, then your care is kind of controlled by a multidisciplinary team. A team, often we'll discuss later a bit more, we're not aware of some of them. There's the person who looks down the microscope, there's the person who looks at the scans, very importantly there's the surgeons, there's the chemotherapy doctors, there's nurses, social workers, there's a whole group of people involved in our care that we're often not aware of. I suppose once a diagnosis is made, I think this is something a lot of you will have felt. Life is kind of catapulted into a roller coaster and control is taken out of our hands to a degree. We go through major surgery, followed by quite harsh chemotherapy, really, then into a stage of follow-up. So living with an ovarian cancer, I think without a shadow of a doubt, all aspects of a person's life are changed. Physically, there's the sequelae of having a major surgery, which is evidenced by a scar which remains on a person's tummy. The chemotherapy also has physical sequelae. There's going to have been hair loss for most people. There can be peripheral neuropathy that's ongoing. And these are things that you live with going forward. Emotionally, I think a diagnosis of a cancer is probably fulfilling the greatest fear in most of our lives. We think, very sadly for other people if they're diagnosed with any type of a cancer, but when it's on your own doorstep, it can actually be very hard to know how to deal with your own feelings or your own thoughts. Sexually, our ovaries are sexual organs. While only about 20% of ovarian cancers are diagnosed in women under 20, if you're under If you're premenopausal, it's going to have a huge impact on things like your fertility is very often taken, and also you can be put into a surgical menopause, which is actually an awful lot more severe than a natural menopause. Of note here, I think it's very important to say that if you have an early menopause, it's very safe to take HRT if you've had a diagnosis of ovarian cancer. Also, very often there's a huge fear amongst couples that particularly a partner can be very afraid that they're going to injure their partner when they've had a hysterectomy, and people very often describe being afraid of bursting the lining at the top of the vagina. And I suppose as health professionals, we're not so good at talking about this. We normally let medical issues take precedence over sexual issues. But we are willing to talk, and we will, so don't be afraid to ask us. And I know Meg Fitzgerald is going to discuss this in greater detail this afternoon. Spiritually, very often people kind of face their spirituality at a type of crisis. But this can go either way. It can be for people who have never felt spiritual before. They can find themselves trying to find a meaning for life. But likewise, for people who have been very religious, they can feel God has let them down. So it's not unusual, really, to raise and to face spiritual issues after a diagnosis. The family role, I think for a woman in particular, has a huge impact. Most women run the family automatically. Don't think men realise what most women do most days. And things that automatically happen all of a sudden need massive coordination and training, and we all know men can't multitask. So this can have a huge influence on everyone, and women carry a massive sense of guilt around this. But I think it's very, very important to realise nobody minds helping, and let people actually like to help and let them help. Financially, every diagnosis of a cancer has a financial impact, whether you're the main earner in the family or whether you are the homemaker. Visits to hospitals, consultant visits, these are all very, very expensive. Now, there aren't massive financial solutions, but there are helps out there, and I know you all got a social welfare booklet in your little pack today, and also it's very important, there are social workers attached to all the hospitals, and there are help, things like medical cards, carers allowance. There are some benefits out there that can help. Survivorship versus recurrence, I think this is what's foremost in most women's minds. People know that unfortunately that there is a high risk of recurrence with an ovarian cancer, and how does one go on knowing this, or how does one then face a recurrence? I suppose it's very important, and you'll hear this more later today. There's always hope, and everyone is an absolute individual. If one reads books and one reads statistics, they can be a little bit frightening, but statistics say nothing of the actual individual. And we've lots and lots of women who are coming back to clinic to us 10, 15 years later, doing exceptionally well. Unfortunately, recurrence can happen, and I'm very aware that there's people in this room where it has happened, and it's often described by women as being much more devastating than the original diagnosis itself. I think it's important to note, though, with recurrence, it's not journey's end. The treatments for ovarian cancer have actually more or less made ovarian cancer more of a chronic illness now when it recurs, and people tend to have to go through periods of being on treatment and off treatment, and there's hopefully even new things becoming available, which I know you'll hear more about later this morning. So just remember, there's always hope. So what can help? I'm going to talk about this. I know I said I'd talk about the issues in ovarian cancer, but I think it's actually important just to look and see what can help us going forward. So I'm going to talk about these in a little bit more detail. Your multidisciplinary team, or access to your gynae-oncology team, like I described earlier, most people see one or two doctors being involved in their care, but you can see the whole list of people here that really make decisions. No single decision is made by an individual for your care. At least once a fortnight we have a meeting where every individual case is discussed at diagnosis, and very often on reoccurrence. So there's an individual plan made for everybody, which I think is very, very important to understand. And that's actually what makes your own case individual and what doesn't make you a statistic. Your psychological well-being, I think this is very important, because I think this is something that we can do for ourselves. Easier said than done, but something we can do for ourselves. I think it's very important to accept cancer has not been your fault. There's 1 in 3 people in Ireland diagnosed with a cancer, so you're not that unique. Cancer affects us all in all aspects of our lives. It's normal to feel overpowered by this. So judge yourself as you would judge others. I think this is very important to remember as well. We can feel very empathetic for the person down the road or for somebody that we love. However, we can judge ourselves much more difficultly and kind of be cross with ourselves when we're not coping. This is probably one of the most difficult things in your life that you've had to face, and it's okay to need help. Try to remain positive. Society and media delight on the horror stories. There is hope for you. The media and the internet tell us nothing as you as the individual. So I think just going back to it, everyone's case is individual. Be informed and help to participate in your treatment decisions. One of the things an awful lot of people describe is losing control, and I suppose that's what the roller coaster was trying to show earlier. So I think that's where it's important to understand your illness, and then you can discuss your treatment decisions within reason, obviously, but at least you feel you're taking control back, which I think is very important in a step with moving forward with your life. Be proactive. There are lots of supports available to you and your loved ones. Make full use of these resources. Some of these resources are outside here, and I'm going to go through them in a little bit more detail. We're not so good in Ireland to make use of these resources, and these resources have been set up for a reason because people think you're deserving of them, so don't be afraid to use them. If you have children, speak to a social worker on how best to communicate with your children. I think, again, this is very, very important. We have a huge sense as a parent that we need to protect everyone, and that's what parents do. However, children are exceptionally perceptive, and children can feel that there's something wrong in a family very often before an adult may feel it. So I think there are ways to speak to children and be honest with them without frightening them, and the social workers are trained in how to help you to do this. So it's just another resource that's very important to use. It's normal to grieve the loss of your health. If feelings are becoming overwhelming, seek counselling. This is very important also. Requiring counselling, it's not a sign of weakness. It can be a very important first step in gaining control within your life again. There's such a turmoil of feelings. This is something that we haven't been trained to deal with, and there's nothing wrong with needing help to getting your feelings together and just getting a view and going forward with life. Surround yourself with people who will support you. These may not be from your everyday circle of friends. Again, you'll have had people whom, and you've probably experienced this, whom you think would be great, who just can't speak to you, and it's not because they don't care. Some people just don't know how to talk around the word cancer. But if that's causing difficulty for you, gain support from the people that you're feeling support from. Communicate with your nearest and dearest. This sounds straightforward, but it's actually a huge problem amongst couples because they're trying to protect each other, and sometimes they lose the lack of communication, and there can develop a loneliness within a couple or a family or a relationship. And I suppose don't be afraid to tell each other how you feel. With that, you can support each other. Feel positive about your future. You will regain a claim to your life. Maybe not the life you had planned, but different isn't always bad. In fact, many women report having had a cancer diagnosis as being a very positive influence in their lives. Finally, pamper yourself. Your body and your mind need relaxation to heal, so don't be afraid to pamper yourself. Access to a specialist nurse. This is where I'm going to blow my own trumpet for a second, okay? I work as a gynae specialist nurse in the South Infirmary in Cork, and I suppose it's very evident in everyday practice what resource that can be to patients. From Monday to Thursday, 9 to 5, patients have full access to me by telephone, meaning that if there's any concerns, they can ring me. Patients can get booked into clinics within a week. Patients can have scans within a few days. Very often, if patients there's going to be symptoms post-surgery, there's going to be symptoms post-chemo, and it can be very difficult to decipher, are these normal or is this my cancer coming back? That simple access and resource is invaluable to patients. In Ireland, there are 6 gynae-oncology specialist nurses in the country. There's 7 breast care nurses in Cork University Hospital. If there's one thing I'd like OvaCare to do, I think it's something that you can do. Specialist nurses will help you. Specialist nurses have been shown to increase compliance to guidelines, increase outcomes. Can't remember what else we do now, but anyhow, we do help. We coordinate your treatment, I suppose, and just direct access to your medical team. What else can help? Accessing the available supports. Ark House has got a stand outside which you can visit later this morning yourselves. It's a cancer support house offering counselling and complementary therapies for persons, completely free of charge. The Girls Club is a new club here in Cork that's only opened recently, which are calling themselves the Fun Side of Cancer. Very resourceful reading, doing lots of walk, makeup classes, different exercise, etc. Definitely worth a visit. Lisa's Wish is a fundraising committee that is very kindly helping to co-fund counselling for us for persons going forward. I know I was talking about psychological health earlier, but it's something that we see as a huge importance, and it's something that we hope people will avail of going forward, is co-funded counselling for persons diagnosed with a gynae malignancy. The Irish Cancer Society, I'm only standing here because the Irish Cancer Society has funded my role. There's 2 booklets in your little packs, and they've come from the Irish Cancer Society, and there's numerous other publications on their websites. They've got a Monday to Saturday helpline that's available for persons. It's a fantastic resource actually. And I think your GP, sometimes once we get caught up in the hospital network, we can forget our local GP is a great resource of local knowledge and local resources. What else can we do to help going forward? I suppose a well-balanced diet. 60% of persons diagnosed with ovarian cancer will endeavour to find something to help themselves, and it's not unusual for people to go on special diets or special supplements, etc. The best evidence that's available is a well-balanced diet that's going to take foods from your food pyramids, including your carbohydrates, your proteins, your dairies and your fruit and vegetables. And this is what's shown to give you the nutrients that you need most for your body. I suppose we need a healthy diet to have a healthy mind, so eating well can actually help us to cope as well. Exercise, I know there's a lady going to speak about this later this afternoon as well, but there's lots of evidence coming out that exercise can increase survival. Exercise not only after treatment but during treatment can help reduce the side effects of chemotherapy, can reduce the incidence of anxiety and depression. Doesn't have to be running a marathon, and that's why the lady is there strolling. Just get out, get fresh air and get whatever exercise you can within your own limitations. Very often, particularly in Cork, there is a huge fear around palliative care services and Marymount, and they're just people that I wanted to mention here today because they're actually a huge part of our service. Palliative care people often view as end-of-life care, and that's not at all how we use them actually. Palliative care are very much involved around symptom management, and there is lots of evidence to suggest that people who have good symptom management actually have a better quality of life and live longer. So I suppose if we do ever mention palliative care to you, don't be afraid of them. It's very, very much for improving quality of life and good symptom control, and we consult with them on a daily basis. Common questions that I get on the phone, I'll just run through them. The internet. There's no doubt the internet is an absolutely amazing resource of information. We all use it every day of the week. I suppose just going back to you being an individual, the internet, 2 things. The internet is not governed, so lots of information is very correct, but some of the information is not so correct. And the internet says nothing, again, of you as the individual. It'll just give a general statistics or a general view. So with specific questions, while of course you can look up the internet, I think always come back for your own situation, consult with your own specialist team. Complementary therapies. People gain great resource and relaxation from complementary therapies. Again, an Ark House is Dr. O'Reilly is on their board, so it's very supportive of Ark House and the complementary therapies available there. It's just, again, it's something that you need to discuss with your specialist team. Some therapies aren't safe during treatment, and particularly supplements. We know some supplements can interact with chemotherapy and can affect the effectiveness of chemotherapy. So just always communicate. We will listen and we'll advise you as best as we know how, but it's always safer to discuss these things with us. Special diets, I think I've discussed that kind of earlier, but well-balanced diets is best what we can do. Research or clinical trials, again, this is my next thing I want OvaCare to take on board today. ICORG is the All-Ireland Cooperative Oncology Research Group in Ireland who attain clinical trials for the country. Since 2008, between 1% and 3% of their clinical trials have been for gynecological malignancies, which isn't even ovarian cancer, that's covering 5 cancers. There are newer drugs coming on board, and Dr. Riley is going to talk about them later, but I think they are looking for patient advocates on their group, and I think this is one place where hopefully OvaCare can help to get a voice and get newer drugs available through clinical research in Ireland. If I travel, will I avail of better treatment? Again, this is a very frequent question asked by relatives, very often more so than patients themselves. At the moment, the answer is no. We follow international guidelines here in Ireland, so the treatments that are available for ovarian cancer are equivocal to anywhere else in the world. CA125 monitoring. Any of you who have an ovarian cancer are aware this is a cancer marker that's very often used at diagnosis and used to be used in follow-up for ovarian cancer. There was a UK study done about, our results came out 2 or 3 years ago, that showed that people whose CA125 was not monitored actually ended up having less treatment and a better quality of life overall. So now we normally discuss with patients, and a lot of our patients are not having CA125 monitoring going further. I have symptoms. Is this real or is it fear? I think this is where a specialist nurse comes in, close contact to your team. Very often we will be able to decipher whether it's something that needs further investigation or if it's something that's quite normal from the sequelae of your treatment. Have I caused my family to be at a greater risk of developing cancer? Ultimately, no. We do know 10 to 15% of ovarian cancers have a genetic link to them. If there is a strong family history there, your consultant will discuss it with you about going for screening and genetic counselling. If it does come back that there is a genetic link, you've been born with this. This isn't your fault. But the important thing is to acknowledge it, and if there are other family members, they can be screened going forward. I've never met another woman with the same cancer as me. I actually often hear this, and sometimes they have met but don't know they have met. But look, today that's changed. Look around the room and mingle at lunchtime, and I'm sure you'll gain more from each other than you'll gain from any of us up here speaking. Will my cancer come back? I don't know. None of your doctors know, unfortunately. But treatments are changing and evolving all the time, so there's always new hope, and there is always hope that it won't come back. And I suppose my cancer did come back, and that's a reality for some of you women here today, and I'm aware of that. And I suppose again to remain conscious that it becomes a chronic illness, and it becomes an illness that's treated between time on and off chemotherapy, and new treatments are becoming available. So again, there is hope. So I'd like to say a big well done to June and to OvaCare. Today is a very positive step in creating awareness and advocacy for ovarian cancer. Today is about you, the persons touched by ovarian cancer. Later this morning you will have access to the experts in treating ovarian cancer, so utilise this. Don't be nervous, ask the questions, write them down. Nobody's going to mind, and no question is silly. And hopefully tomorrow ovarian cancer has a voice in Ireland. Thank you very much.